If clinicians and health professionals don't try and see things through the eyes of the patient, they can't actually know what's going on. They can never experience what's happening to them. The project is actually designed to bring GPs, patients, the PCT and the Oxford Centre for Evidence-Based Medicine together as partners in a project. And the mantra is primary care led, evidence-based and patient-centred. I was one of the original group that went to the Health Foundation for the funding. We then had to decide what projects we were going to do. And what normally happens in the National Health Service is the PCT decide. And what we did, and it was a sort of an experiment, was to say, right, the PCT will get X number of votes on what's going to be looked at. The GPs will get X number of votes, but the public and patients will have X number of votes. So we threw everything up in the air, voted for a whole myriad of things, and came up with our initial group. We have about 500 citizens of Milton Keynes who have signed up to be members of our organisation. We send them newsletters, we keep them informed. We have regular weekly contact with over 200 voluntary organisations. And so when something like Diabetes Project comes along, we send out a message saying there's a project, anybody with the condition and diabetes who is interested, get in touch with us, and then we nominate people. Everybody who's nominated by us to a project has to write a report on what's happening. They're not always overly confident, faced with half a dozen clinicians talking in a language they don't understand. They have problems, and they can come back to us and talk about those problems, and we can help to support them. In the time that we've been involved in this project, the level of public-patient engagement has improved to the extent where the PCT now doesn't begin any major project without coming to us and asking for involvement.